Hello and welcome. I'm Steve Clemons, editor-at-large of The Hill. Thanks for joining us for the challenge of our time, the COVID-19 vaccine. This is going to be a big program. From the moment we became aware of the pandemic, the scientific community across the world just mobilized to develop a vaccine that would help us get back to living our lives. That unprecedented effort has resulted in 2 approved vaccines in America, and more are on the way. And the speed with which these developments have taken place is really unprecedented. So today, in a 2-part summit, we're going to attempt to first understand the conditions that led to the manufacture of vaccines. And the second half, we're going to take a microscope and look at the distribution process and that, famous last mile challenge. It's going to be a fascinating journey. We're going to learn a lot. I'd like to thank our sponsors, 3M Corporation, the Healthcare Distribution Alliance, and UPS Healthcare for their support of today's event. I'm not going to sugarcoat it. Grim milestones continue to be hit. We're expecting the death toll from this pandemic in this country alone to reach 500,000 by next month. And that means after that month and after that month and after that month, we're going to still see just horrible numbers. And we're going to have to figure out how we get to a light at the end of the tunnel of this. And we're going to be discussing this with many of the great experts today. The vaccines that have been approved and are beginning to make it into the arms of every millions of Americans today are promising. But the hard work is just beginning as the challenge to vaccinate nearly 7.8 billion people across the globe is becoming a reality. Before we get the conversation started, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillVaccine. We're broadcasting live. We'll be taking your questions throughout the program. As with any live stream, if you experience any occasional trouble with a video, good luck. They say refreshing the page should fix most of these problems. My next guest will talk about the science behind the coronavirus vaccines. She's a practicing physician and former Baltimore Health Commissioner. Dr. Leana Wen, thank you. I mean, right now I see your voice everywhere. I see you on CNN. I see you in the Washington Post. And you're kind of the, in a way, the conscience of the moment, talking about how we set expectations in this challenging time. So let me just start out in saying, we have a new administration coming in, a new team, a new coronavirus advisory commission. What do you think the most important things are that they need to be doing right now?
Well, I think the new administration is already doing some of those key elements that we've been asking from the Trump administration now for a year. There is, first of all, clear, consistent communication to the public with having briefings that are led by public health experts and scientists, which is really critical. There's also been consistent messaging between top public health officials and elected officials, something else that's been missing for the last year. And they have finally outlined a national strategy, which again is really critical, that this is not just states and locales on their own trying to figure out a vaccination program. We're trying to figure out testing and PPE, but that there is federal responsibility, federal oversight, federal guidance, support, and partnership with the states. I think that's all fantastic. I do think that what could be done more of, and I recognize that the Biden team has only been in for a week, but I think that what they can do more of is to set aspirational goals. I recognize that 100 million doses in 100 days is already going to be challenging to do, but that's also the rate that we're already at right now. And I think what Americans need right now is hope. It is this grand aspiration. We need a man on the moon moment. And even if that goal cannot be accomplished, we need to see that this is what we're aiming for. So I would actually love for the Biden team to say, we want to get everyone in America vaccinated by the end of the summer, or something that's very aspirational. And yes, we probably are not going to achieve that, but let's try to aim for it. And let's try to end the pandemic in 2021.
You've also written, Dr. Wen, that we need to do some unusual things. We should look at a city like Chicago or New York or Seattle that has been hit so hard and just show how you can do in mass and do mass vaccinations in a city like that with lots of partners, or taking over, major stadiums and other places of this sort. Do you see any steps in that direction from the administration?
I think that what they have outlined in their plan, the parts of it that I like, then there are many. The idea of expanding vaccination sites so that you're enlisting community pharmacies. That's one of the reasons why West Virginia has done so well in the vaccination program. They're enlisting trusted places in the community, having federally qualified health centers, expanding eligibility so that there isn't such a supply demand mismatch in places. I think those are all the right things to be doing. And I love what they're saying too, with targeting hard hit communities and then having federal vaccination sites be stood up in these areas, having mobile vans to reach people. I think that's all great. But I also think that they should be doing more with innovation. And specifically what I mean is there are cities like New York City, I think is a great example of this, that actually has really good public health infrastructure in place. They are capable of delivering many more vaccines than they're currently given. I think that the federal government should be selecting 10 places across the country, some rural, some urban, that say we can get 1 million vaccines out in our region in a month, or some other high aspirational goal. Let them do it. Let them figure out the playbook that everybody else can learn from. I think we'll also learn from these innovations as well. I think that, there is a tendency to misunderstand equity to mean lowest common denominator, as in we should be giving each locale exactly the same number of vaccines. I don't think that's right. There are some locales that are not able to distribute them right now. We need to be helping them. The federal government needs to be helping them to develop that infrastructure so that they can do it. But in the meantime, don't hold everybody back. Let those that are ready to go do it. And that's one part of the Trump administration's plan that I really liked, which is to give states allocations of vaccines that are proportional not only to per capita, but also to their proven ability to get out vaccines faster.
One of the topics that you and I have discussed many times over this last year, but particularly at the beginning of this crisis, is how underinvested in our public health infrastructure was. And when I talked to Dr. Redfield from the CDC, Dr. Birx, other people, they said the same thing. Are we beginning to look beyond this virus at the other dimensions of public health and beginning to get some of that right? Because I remember you were on the board of, the border of anger about how we had underinvested in public health infrastructure. And, all of our conversation is about COVID vaccines, but there's a broader dimension of public health. And I'm just wondering, do you see any steps now, or would you recommend any steps that we begin addressing that as we're in the moment of crisis and people feel the tension of this time?
Such a good point. And I don't want us to lose this moment. I want us to move beyond the pandemic, but I don't want us to forget the lessons that we're learning, including how much this pandemic has unveiled these existing issues of health disparities, unequal access, and also this chronic underinvestment in our public health system that way predated this pandemic, but the pandemic really highlighted. I think we're doing some of that now. I think we're seeing, for example, as you were saying with vaccines, what happens when we don't have infrastructure in place, when the same people who are tasked with doing testing, contact tracing, and all their existing duties now have to set up a vaccination program, and we don't give them funding to do that. We're seeing the consequences, which is no ability to be able to get out the vaccines quicker. What I don't want to have happen, though, is I don't want us to just invest in this moment and then forget about it afterwards. The Biden plan, for example, has this, I think, again, a very good plan to have 100,000 workers who are now going to be part of the public health workforce, or maybe doing contact tracing or helping with doing vaccinations. That's fantastic. But what happens after that? Who is going to sustain that funding? Of course, I would love to see these workers be folded into the public health workforce on the local and state level, but with very stretched budgets. Are we really saying that cities and counties are now going to be funding these new workers? And if not, how are we going to sustain the investment in public health? So I think that there needs to be a much broader conversation and time to have about what is the role of public health? Is public health just something that's not private health? Or is it something much broader that touches upon social determinants, that actually addresses people's health and well-being, that really addresses these critical, I think, social justice issues that are also unveiled by this pandemic too?
Just as we wrap up, one of the other things that is haunting this discussion today with so many luminaries that have been involved in this is the question of is this now going to become a permanent part of human life, of America? When you hear the president of Moderna say COVID is not going away, we're going to have now figure out how we live with this virus and mutations and all of this coming down. Use your crystal ball and tell us, as we react to this moment and react to this challenge, how do we get strategic with the framing and scaffolding that others are saying, this is now with us permanently?
I think there is a best case scenario to me. The best case scenario is that if indeed these vaccines will virtually eliminate severe disease from COVID, and if we all end up getting vaccinated or a very substantial number get vaccinated, then we can make the virus that causes COVID-19 no different from the common cold. So that way, we're not really afraid of getting it. I mean, it's still better to not get it, but if you get it, if all you get are mild cold-like symptoms, that would be great. I think this is a possibility. We can get there. But the question is, what's going to happen in the meantime? How many lives are going to get lost? Are we going to win this race of vaccines versus variants? Could there be more variants that develop over time that are not only more transmissible, but also more deadly and more virulent and may escape the detection and the protection of these vaccines? And so I think there are a lot of unanswered questions, but we actually do have a best case scenario. And I think as with the rest of this pandemic, yes, there are many things that are unknown, but a lot of what determines the outcome is up to the actions of each and every one of us.
Well, Dr. Leana Wen, who, your voice is so vital. Every time I talk to you, I sort of discover more blind spots that even I have in this discussion. Thank you so much for sharing your thoughts and candor with us today.
And thank you, Steve, for your leadership and your incredible service.